13 Friends for Life, sponsored by Graphids Heating and Cooling, your home cooling experts.
Actress Olivia Munn revealed this week she was diagnosed with breast cancer and had a double mastectomy, a discovery she said she would not have made without a risk assessment tool from her doctor.
I spoke with local health officials about what this is and how it could also work for you.
Do it for him, do it for your baby. This stuff doesn't matter.
Actress Olivia Munn. You may have seen her in the show The Newsroom or on The Daily Show. Now raising awareness about early screening for breast cancer. In an Instagram post this week, Munn shared she had been diagnosed with breast cancer and had a double mastectomy, a discovery she would not have made without her OBGYN.
1 in 8 women will develop breast cancer in their lifetime.
The 43-year-old actor said both a genetic test for common breast cancer genes and a yearly mammogram revealed no cancer. But 2 months later, her doctor did a breast cancer assessment score, putting her at a higher risk for breast cancer over the next 5 years.
Every woman should be having a conversation with their primary care provider between the age of 25 and 30.
That's Jennifer Johnston, the clinical advisor for breast imaging at Corewell Health. She says the risk assessment is something an OBGYN or a primary care doctor will do at a checkup.
It involves things like looking at family history of cancers, but then taking into consideration personal factors such as age, the time that you started your menstruation, your age at the time of your first pregnancy.
A score above 20% suggested to have additional screening, usually a breast MRI. That's when Munn says doctors found her cancer.
So we recommend that women start annual screening mammography at the age of 40, but for patients in a high-risk category, starting at an earlier age between 25 and 30 years with either screening mammography or breast MRI may be helpful in just enhancing and screening opportunities and being more sensitive in our search for potential breast cancers.
The breast cancer risk assessment is one way to detect cancer early, which is key to fighting it.
You're going to be afforded the opportunity to have a less invasive treatment.
Now, there's also an online version of this test that you can do that's on the National Cancer Institute's website. So I was able to go in there and find out my risk for not only the next 5 years, but also a lifetime risk score. And you can find that. I've linked that in this story on 13OnYourSide.com.
And that's another part of Friends for Life, just being able to provide information on that.
Exactly. So talk to your doctor.